Hello, welcome to this presentation of the Living Alone and Connected group about finding community support in person. Our group, Living Alone and Connected on Facebook, is all about finding support from the virtual community online. But this presentation will offer some tips and tools and ideas on getting started with finding support in person in your community. So, we will get started with the presentation here. And before I move forward, I'm Michelle Seitzer, group moderator for Living Alone and Connected. Right? Let's begin. Finding community support. So first, I want you to think about where you are already plugged in your community, whether it's a church group that you've been attending for years or maybe just recently, whether it's going to the same diner for breakfast every Wednesday morning, whether it's volunteering at a local school. Where are you plugged in your community? Think about that for a moment before we move on. There's lots of ways that you can be plugged in. It doesn't always mean that you're plugged in a supportive setting as far as going to a support group or going somewhere where you're getting help. Sometimes being plugged in helps you just by being active and engaged in your community and not necessarily at a dementia specific support group. So think about the ways that you're plugged in your community. So what is available to everyone? So regardless of where you live, whether you live in the woods or on a farm or in the big city, what's available to everyone who is an older adult, 60 and up, living alone with dementia? So these resources come from alzheimers.gov, where you can, oh, I'm sorry, gonna go backwards now, and now I'm going forwards. I apologize. There we go. Alzheimers.gov is the website where I accessed these links and this bulleted list of resources that are available to everyone, regardless of location. So everyone has a local area agency on aging. Everyone has local chapters of the Alzheimer's Association available to them. And there are other nonprofit organizations that are nationally represented, such as the Alzheimer's Foundation of America, the Lewy Body Dementia Association, the Lewy Body Dementia Resource Center, the Association for Frontotemporal Degeneration, and the National Task Group on Intellectual Disabilities and Dementia Practices. Local and state government or tribal social services and programs are available and accessed through the Elder Care Locator or the Indian Health Service. And then there are federally funded resources such as the National Institute on Aging. They support a number of Alzheimer's disease research centers and also ADEAR centers, Alzheimer's and related dementias education and referral centers. ADEAR is a lot easier to say than the mouthful I just gave you. But all of these are federally funded resources in your neck of the woods. Of course, some of them may be closer to you and further from you, depending on where you live. But these are resources that are available to everyone. And of course, nowadays, it's easier to access things online and then get connected in person in your community once you make that connection online first. And then there are a variety, of course, of paid services which require personal funds. So while that is available to everyone, it may not always be affordable, but we'll talk about that on a future slide. And then This presentation will be added to the Living Alone and Connected Facebook page, so you'll be able to flip through it and click on these links yourself. And so here is a link right here that has more options, more resources beyond these ones listed on here on this slide. And so feel free to click through to that link and check those out. So what's available in your neck of the woods? And like I said, you're all living in different locations, some more rural, some more suburban, some more metropolitan or urban. So these can vary, but um, in terms of getting you to think about other ways that you can connect and be engaged in your community and find support, it's not always through a support group. Sometimes just going to the post office. And that's why I had this image here of somebody dropping off a letter at the post office box near the post office. Barbershops and salons, diners, churches, thrift stores, Meals on Wheels, volunteer organizations, hospitals and healthcare centers, shopping centers, community centers, social service organizations. There are a variety of places. The gym, maybe some of you go to the gym or you go to your local YMCA to work out. These are all places where you can connect to community support because support looks different for everyone, and we all need different types of support, not just the services that a support group provides. Making connections with people. I did not list the pharmacy. I would include that with hospitals, healthcare centers, etc. But sometimes just going to your pharmacy to pick up your prescription is a way to engage community support because your pharmacist is very knowledgeable and they're somebody that can help you if you have questions about your medications or other things that might help, vitamins or supplements that could be beneficial. So remember that in-person community support doesn't always mean going to a support group at a hospital or nursing home. Sometimes it's going to the diner and seeing people that um, you see on a regular basis, whether that's other patrons or the same waiter or the same hostess or host. Making those local connections is a great way to connect in your community because then if you don't come for a couple weeks at a time, somebody's missing you, somebody's looking for you, and they can check in with you. So how do you know what you need? Who says you need community support? Who says you need to access services or make more connections locally? Maybe you don't think you do, or maybe you don't know what it is that's missing. Sometimes we don't know how to express what we need or what's missing in our lives. Sometimes it feels uncomfortable or maybe even unnatural to do so. We want to handle it on our own, or we're afraid that by saying we need something or someone, that it means we've done something wrong or that we're not able to manage our life on our own. And that's not the case. You're all managing very well on your own, but there's probably some areas where you could use a little help. Or maybe you don't think you're managing well on your own, but you don't know how to reach out or who you can reach out to or what it is that you really need. This is a process. It does take time to identify those needs. And living alone can make this process even harder because we don't have a person to talk things out with in our immediate living space. We might not have someone who's a sounding board for us. Or somebody who can identify something that we can't see in our day-to-day lives. Sometimes the best place to start is by looking at our day-to-day life and thinking about the places or parts of our day where we get stuck, frustrated, overwhelmed, or stressed. And that can be a good starting point for identifying what it is you need. Do you need more social connections? Go to the diner. Do you need more health advice? Talk to your pharmacist. Do you need to talk to other people who are living alone with dementia like you? Of course, we welcome you to join our support group here online on the Facebook page, but sometimes you need that in-person connection and to be sitting beside someone who says, I understand, I'm with you. So, what makes getting support and connecting to community resources a challenge? Well, once you've identified what those supports are that you need, it doesn't mean connecting to them comes easily. The services you need, or the people you need, or the encouragement you need might not be available. There might be waiting lists, or it might not exist. It might not be affordable. It might not be accessible. You might not be able to get to certain places like a diner, um, or a healthcare center without support. You might need somebody to come to you to help you get to these places. So that represents an obstacle to getting started or getting connected. Sometimes the services are not appropriate. Maybe you've gone to a support group in person and it wasn't a good fit. And that's okay. That happens. But it can be frustrating and it can also lead to giving up on finding a better fit. And as I said, as far as things being accessible or even affordable, maybe you need to reach out to someone on a regular basis, or even one time to ask for help financially or ask for help in terms of transportation. Uh, you may need to register for an event, and you might need to remember that you registered for that event, and that can be challenging given your diagnosis. And if you have been living alone for a while, it's hard to get into that mindset of reaching out. It can be really challenging if you've been independent and living on your own for a while to remember that there are people out there who are willing to help, but you have to say the word. So it puts the burden on you to remember that, and that can be tricky. So, one thing you might want to try is talking to somebody who you really trust, who you really feel comfortable with, and asking them to check in with you, sort of like an accountability partner to say, "Hey, can you check in with me once a week to see how I'm doing and to see if there's anything I need?" That way, you don't have to remember to reach out, but they reach out to you. So how do you access what you need? I've already gotten into that a little bit. So here are a few more practical tips for getting the support you need from your community, virtually, locally, nationally, and beyond. Ask a neighbor, friend, or family member you trust and feel comfortable talking to. Ask them. Ask them to help you access what you need. Write things down or record voice messages as reminders. Be patient with yourself and the process. This is not an easy process. Again, like I said, especially if you've been living on your own for a long time and managing on your own, it can be hard to get into the habit of reaching out. So, that being said, keep practicing. It's a skill you can develop. Keep practicing, keep trying, keep doing it. If you give up, you're stuck. And I don't mean to say that in a uncaring or cold way. But it's tempting to give up, right? When we feel frustrated or feel stuck or feel overwhelmed. But unfortunately, or fortunately, depending on how you look at it, we have to keep trying so that we can get to that place of being more connected to the services and supports we need. And that being said, again, understand that connecting to support is a sign of strength and a way of preserving independence. Keep the goal of independence in mind. This is reaching out for help can be scary because sometimes we think it means we're going to have to rely on support, or we might lose our independence. But if we look at it in a different way, in understanding that by reaching out and getting support we need to fill in those gaps, hopefully we can stay independent longer and safer and in a more fulfilled kind of way. So, those are my thoughts and tips and suggestions, words of encouragement and advice that I wanted to share with you about identifying in-person community supports and how to make those community connections successfully. As always, we welcome your questions, your thoughts, Where do you get stuck accessing community support? We want to hear it all. We want to hear from you. So send us a message or post them on the page and keep connecting.